my name is Gabby. I'm going to be the massage therapy student for today. And today I'm going to be taking my client Justine through a shoulder assessment. Before we would do the objective portion of the assessment, we would take their health history information and also their subjective information. Before you would proceed with the shoulder assessment, one question you would ask your patient is that if they previously had any dislocations or shoulder injuries. Since it is a highly movable joint, people are highly susceptible to shoulder injuries, and then that way you would want to be careful with what movements you choose to assess. So first we're going to begin with the rule out, so the joint above and below, to make sure the pain is not coming from any of the joints above and below. So what I'm going to have Justine do, I'm going to have Justine look up to the sky. Any pain?
No.
Add some pressure? Okay. Any pain?
No.
Okay, and I'm going to have her look down to the ground. Okay. You got pressure? Okay. Any pain?
No.
So the above joint ruled out. Relax. The above joint ruled out. So now we're going to begin with the joint below. And for the purposes of today, we're only going to be ruling out the right side. Let's just say her right side is the one that's bothering her. So I'm going to have Justine stand up. I'm going to have your fingers touch your shoulder. Any pain?
No.
Can I have pressure? Any pain?
No.
Okay, and then extend. Can I pressure? Push her into some hyperextension. Any pain?
No.
Okay, so Justine can sit down. And both the above and the below joint ruled out, so we are good to move on with the active range of motion portion of the assessment. For the assessments of range of motion, you would want to do the unaffected side first and the affected side. But for the purposes of today, we're just going to be doing the affected side. So the right side. So I'm going to have Justine stand up. And I'm going to have you all the way to the ceiling. I know it's a little bit hard because we have a ceiling that's low. Any pain?
No.
Okay, I'm going to have you put your hand back to your side. I'm going to have you push back your hand as much as you can. Any pain there?
No.
No? Okay. I'm just going to have you move this back a little bit so you have more space in the ceiling. And then I'm going to have you bring your arm above your head, like that. Any pain?
No.
And then I'm going to have you bring it back down. Any pain with that movement?
No.
Okay, now I'm going to have you do is I'm going to have you bring your arm up to the side like this, like a T, and then bring it across your body. Any pain?
No.
No? Okay, and then from there, go 90 degrees like this. I'm going to have you turn your shoulder in. Any pain?
No.
And then turn your shoulder out as much as you can. Any pain?
No.
Okay, so you can sit back down. So the active range of motion portion of the assessment is complete. There was no pain or any discomfort with those movements, so we're good to move on with some measurements. So I'm going to have, first I'm going to do the horizontal adduction since she's already seated. So again, I'm going to have you put your arms out. This. And then the axis should be on the top, so it should be where the head of the humerus is. So if you palpate for that. Okay. Set your marker at 0. I'm going to have you bring it as far as you can to the other side. And then follow it. There we go. And make sure it's parallel. Okay, you can relax. And Justine got 135 degrees as a measurement, and the correct measurement according to McGee is 130, so she is within normal limits. So now I'm going to have Justine lay down on the table. I'm going to measure her right side, the other movements. So now what I'm going to do is I'm going to have Justine move a little bit to the, to this side. Sorry, a little bit more. Yeah, back a little bit. There we go. So her shoulder is supported by the table. And we're going to be measuring internal and external rotation. So the point of your goniometer, so you're going to be having it together like this, should be at the tip of the patient's elbow here, and then your arms of your goniometer are going to be lining up parallel with the forearm. So I'm going to have Justine go into 90 here. I'm going to have her move a little bit this way towards the table so her elbow is a little bit supported. A little bit more. Okay, so her arm is neutral like this. And if the client deviates, make sure it's to correct them and straighten it out. So again, point goes onto the tip there, the bony prominence of the elbow. and then I'm going to have you put your palm towards the ground. So one arm stays up and the other one follows. Okay, relax. Yeah, so Justine, as a measurement, let me see here. Justine, as a measurement, got 7 degrees of internal rotation, and that's within normal limits because the normal limits of that is 60 degrees to 100 degrees according to McGee. So now what we're going to do is we're going to do external rotation. So that one people have a little bit less, and the normal movements with that is 80 to 90 degrees. So I'm going to have Justine again go to neutral. Point goes on the bony prominence of the elbow, and I'm going to have you go the opposite way. So one arm stays up, the other one follows and remains parallel here. And go up, relax. And Justine, as a measurement, got 105 degrees. So she is a little bit above the normal range. That's okay. Sometimes what happens with the shoulder when people do internal external rotation is that the shoulder or the back of the shoulder, the blades will come off the table. So that kind of counts as an inaccurate measurement since they are compensating for that movement. Next, what we're going to do is we're going to do flexion of the shoulder. So when she brings her hand up over her head. So have her hand here, and your bony landmarks will be the head of the humerus. Palpate for it. Put the point right at the head of the humerus, and then the arms will follow the arm that's producing the movement, and then we'll take our measurement. So again, that's about there. And you can do this either laying down or standing, but I feel like doing it laying down is a little bit more accurate because the patient won't deviate to their back or curve their back to get that flexion. Okay, so when you're ready, you can bring your arm over your head, and then one arm falls, and the other arm stays parallel to the side of the body. A little bit more. All the way you can go. Okay, and relax. So Justine got 180 on this measurement, and that is within normal limits because flexion is 160 to 180 degrees. Next, what we're going to be doing is abduction. So some people with abduction, they do it standing and they measure posteriorly the measurement. I like to do it laying down. I think it's a little bit easier for the therapist and you get more of an accurate measurement. So what I'm going to have Justine do, I'm going to have her do abduction all the way up. And that's as much as she can go. So I'm going to palpate for her lesser tubercle of her humerus, which would be, it's very easy palpable when right there. It's very easily palpable when the shoulder is abducted, and the point will go in the lesser tubercle. One of the hands will stay parallel to the side of the body, and the other one will stay parallel with the humeral bone there. Okay, relax. And Justine's measurement is 150. So abduction generally is 180, but there's a lot of structures there that may inhibit the full 180, such as bursa or tight muscles. Was there any pain with that?
No.
So since Justine didn't experience any pain with that, I wouldn't be concerned with it. The next movement would be adduction. Justine already performed adduction. Measuring is a little bit harder because people compensate usually forward and back. If there is no pain while she's doing adduction, so I'll show you guys. Go back to abduction. And when she's bringing it back to her body, if she doesn't experience any pain or discomfort or any kind of crepice, then there's no need to measure it. And the last one we're going to do is we're going to be doing extension. So extension again, head of the humerus is going to be your landmark, the pinpoint in the middle of the goniometer, and then the hands are going to be parallel to the humerus, and as the hand moves back, one of the arms of your goniometer is going to move back as well. So I'm going to have her go to the edge of the table so she can actually produce extension of her, and I'm going to have her keep her hand neutral to the side there. And then palpate for the head of the humerus, and then when you're ready, you can bring your shoulder back. And then one arm stays parallel to the side, and the other arm of the goniometer is parallel to the humerus. Okay, you can relax. And Justine got 95 degrees there, so that is a little bit above normal range. Normal range of extension was 50 to 60 again. sometimes the shoulder will come up a little bit, and that kind of deviates the accurate measurement there. So since there was no pain with the measurements and we're all done the measurements, now we're going to move on to passive range of motion. So passive range of motion is for any to test for any ligamentous issues, and this kind of range of motion is therapist done only, so the patient will be as relaxed as possible, and I'll be taking her through the movements. So we can stay here. We can start with extension. So I'm going to have Justine as relaxed as possible. I can stabilize her shoulder here, so again the shoulder won't come forward like this, and then I can push her back into extension. Any pain? No? Okay, so that is tissue stretch. Now I'm going to be doing flexion. So again, grasping here around the humerus, and you can stabilize here, around. Any pain there? Okay, so that is also tissue stretch. Sometimes it can be approximation because the bony structures will kind of come together there, the AC joint there. Okay, and now I can do internal and external rotation. So I'm going to have you come to the edge of the table, the other side, yeah. Okay, that's good. Again, stabilizing the shoulder joint. I'm taking her into internal. Any pain?
No.
Okay, and external. Any pain? No. Okay, so that is tissue stretch. Now we have, bring her back to neutral here. We have abduction and adduction. So again, stabilize. You can hold on to the humerus and then bring her into abduction, and then adduction will follow after. Okay, and Justine has a very small arm, so it's very easy to manipulate her arm. If it were to be a bigger individual, you would probably have to have more grasp and stability. The last one I'm going to do is I'm going to do horizontal adduction. So I can have you come a little bit towards me on the table. Okay. I'm going to have her arm like a T, stabilize the top here, and then bring it across. Any pain?
No.
No? Okay. So that means everything is normal there. No pain, so that means she has no ligamentous issues, and that was also considered a tissue stretch. So now that we've done passive range of motion, now it's time to do resisted range of motion. So resisted range of motion tests for muscular issues. If there's a tear or anything like that, that could be found within the resisted range of motion assessment. So what we can begin with is that we can begin with flexion of the shoulder. Come to the edge of this table for me. Sorry, a little bit, sorry, more centered, yeah. Okay, so have her arm 90 degrees, this is how I like to do it. Grasp down on the humerus, stabilize here, and ask her to try to flex her shoulder. So try to bring it above your head. 1, 2, 3, 4, and 5. Any pain?
No.
No? Okay, so there's no pain there, so that is strong and painless. And now I'm going to have her do, now you can come to the edge because now we're going to do extension. Okay, support, and have her push down to my arm. Yeah, 1, 2, 3, 4, and 5. Any pain?
No.
No? Okay, so extension is strong and also it is painless. So now what we can do is we can do internal and external rotation. So come to the, shift to the other side of the table so your shoulder is supported. Yeah. So how I like to do it is I like to have her already kind of in this position. Yeah, in this position here. And how I like to do it is that she can do it against my thigh here. So if I have her here, and she's at 90. Now, press up against my thigh. Yeah. So just try to do external rotation, and then you could switch your thigh positioning, and now do the other way. Yeah. She's pressing down against it. Okay. So that is internal and external rotation. Any pain?
No.
So that is both strong and painless. And now we're going to do abduction and adduction. So adduction, have her a little bit out here. Stabilize and try to bring your shoulder this way into your body. Yeah, 1, 2, 3, 4, 5, and then switch your hand positioning and the opposite way. 1, 2, 3, 4, 5. Any pain? No? Okay, so that is also strong and painless. And horizontal adduction, what you can do, you can have her up here, Our stick our arm out like this. Stabilize the opposite shoulder and bring this towards my hand. Bring it up. 1, 2, 3, 4, 5. Any pain?
No.
No? Okay, so that is also strong and painless. So that is the assessment of the shoulder joint, active, passive, resistant, and following some measurements. Thanks for watching.